I'm Chloe. I'm going to be your nurse today. I'm just going to do a quick assessment of your heart and your cardiovascular system. Let me just do some quick hand hygiene. Alrighty. You're looking good today. You having any pain or trouble breathing?
No, I don't think so.
Okay, perfect. I'm just going to take your blood pressure real quick. Do you have a preference on which arm?
Left is okay.
Now, it might be a little tight, but we'll get it done here.
Can I put my arm down?
Yeah, you can put your arm down. I'm just gonna lay this on your lap.
Okay.
Baby. That's a good blood pressure.
Thank you.
It was 122/80.
Oh.
Very nice. Oops, sorry. I'm gonna put you here. Now I'm just going to palpate your different pulse points and make sure everything is equal. There's no abnormalities or anything. So I'm going to do your temporal. Sorry. Yep, they're both equal. They have 2+ amplitude on both sides. That means they're the same. So I'm going to do your carotid. Yep, that sounds good. Perfect. They're both equal, 2+ on together on each side. So that means it's good. And on the carotid, you have to do them separate because you don't want to press at the same time. Now I'm just gonna look at your jugular. Yep, there's no distension. You're properly hydrated. You drink enough water during the day.
I think so.
You think so? That's good. All your veins look good. Your skin looks good. There's no abnormalities. Looking beautiful. Now I'm going to listen for any bruise on your carotid. And I'm going to do that with the bell of my stethoscope
Okay.
instead of the diaphragm, which is this side.
Oh.
This is the bell. No bruit. No bruit. That's good. Now I'm just gonna palpate and feel the rhythm and count your pulse in your radial, and I'm gonna palpate your, which just means touch,
Okay.
your brachials. Brachial. Yep, both are equal. Yep. Oh, strong pulse. Now I'm just gonna hold and count for about 30 seconds. So that was about 40 to 41 beats in that 30 seconds there. So it gets you about 80 to 82 beats per minute, which is within the normal range. But you usually go from 60 to 100. 60 being on the lower side. If you're below that, that's bradycardia. And if you're above 100, that is tachycardia.
Okay.
Alrighty. Now I'm just going to palpate your femoral, which is right here around your groin, and your popliteal. Your dorsalis pedis will be on the top of your feet, and your posterior tibial is on near your on the inside of your ankle there.
Okay.
And also your pulse, the rhythm. There didn't feel any extra like gallops or extra heartbeats. You just had a S1 and an S2, so a lub dub.
Oh, good.
Alrighty, and let me check. I'm gonna palpate femoral here. Right in there. Okay. Everything feels equal. I'm gonna leave your dress down. I can just feel it through your dress. It'll be fine.
Okay.
I'll do your posterior popliteal here. And then I'll do the posterior tibia. Perfect. Everything feels normal.
Awesome.
Now we'll do these guys. Perfect. Oh, everything feels great. Let me palpate your, go down, go right here. I can feel your dorsalis pedis pulses fairly well. Sometimes they're difficult to find. All your pulses are 2+, which that just means that they're equal, not too fast, not too slow, or shallow to feel, and they're easy to locate. I'm just gonna look at your skin. Yep, everything looks good. There's no varicose veins or anything that is sticking out to me. Your skin, let's do a little skin trigger. I can do it on your foot. Yep, it was less than 3 seconds, so that's perfect. No abnormal hair growth or anything that just is not normal. Let me just do a quick capillary refill on your nails up here. Check, make sure everything's good. Yep, less than 3 seconds. Let's do this one. Yeah. Quick pinch there. You're all hydrated. Let me do this hand too. Perfect. Everything's looking good. There's nothing sticking out. You don't have any irregular heart rate or heartbeats or anything like that. So that's good. Now I'm just going to measure and compare your anchio-brachial index, which is taking the systolic pressure from your blood pressure in your arm and comparing it to the systolic pressure in your lower extremity.
Okay.
Now, since I already did it up here, and what did I say it was, like 122?
Over 80.
Yeah. And then I'm just going to do it on this lower extremity to compare. Usually when you do the brachial index, it's just going to show a difference in your top number, which is your systolic, and it's about a 10 to 15 number increase or decrease. It's just a difference showing how the blood flows in the body. So let's just do a quick blood pressure on your ankle here. In simpler terms, I'm going to sit down. Just have to line it up with the artery. Alrighty. Most of the time we just do blood pressures in the arms, and sometimes they have to do them in the legs They'll do it with the popliteal, or they'll hook it up and do it with your dorsalis pedis if they really can't find pulses up top. Most of the time it's with the brachial and the radial. That's the most common sites. So we should see a little bit of a difference increase down here. Yep, there's definitely a little bit of an increase. And when you do the math, your estimate for it was about around the 140s is when your systolic started to come in, so that wasn't bad at all. Set this up here. Oh gosh. That just puts your brachial index around 1 to 1.4. So that's within normal limits. Everything's looking good. Do you have any concerns? I'm just gonna look at your back and check your skin and your breathing. Make sure there's no extra muscle. You're not using any extra muscles to breathe, or like what they call retracting. I'm just gonna feel. Okay, you're nice and warm, normal. All your contours in your skin and your muscles look great. Can you take a deep breath for me? Oh, perfect. There's no extra retractions or anything like that. So I think that's everything I have for you today. You overall have a pretty healthy heart. All your pulses and your blood's flowing in your body. There's nothing really that the doctors or anybody should be concerned about. You are warm, you're not too pale or anything, and you have proper capillary refill, and all your pulses are palpable, and I did not hear or note any extra distension in your jugular or palpating anything in the carotid or hearing any bruits. Yep, and there was no extra pulsation at the jugular as well, so that's good. Well, do you have any questions for me?
I don't think so.
Okay, thank you. Have a good day.
Thank you.
I'll pass off to the nurse. Everything was good.
Appreciate it.